Bangladesh remains one of the poorest countries in the world, and Bangladesh's HDI value for 2011 is 0.5 in the low human development category, positioned at 146 out of 187 countries. 84% of the population, or 129 million people, live on less than $2 a day, and at least 30 million, or 20%, cannot afford to meet 80% of their minimum food needs and are classified as extremely poor. These people suffer from extremely poor coverage of access to water supply and sanitation, especially in the river basin and coastal areas of Bangladesh. The Poverty Reduction Strategy paper, PRSP, reports that in some coastal areas, the water supply rate is 240 people per tube well, while the national average is 20 per tube well. The Joint Monitoring Program, JMP, of WHO, UNICEF reports that sanitation coverage in rural areas is around 32%, but in most cases, the latrines are basic and provide little in the way of privacy and dignity of users. The low coverage rates for water and sanitation service delivery in the river basin and coastal areas, coupled with the unsafe hygiene behavior of the population, results in the high transmission rates for waterborne diseases responsible for 24% of all deaths. Bangladesh's recent PRSP calculate that diarrheal diseases kill 110,000 children below the age of 5 annually.
আগে খোলা জায়গা পায়খানা করছে, যেখানে সেখানে মশা মাছি ঢুকছে, ঢোকার পরে খাওয়ার জিনিসের মধ্যে আশ্রয় নিচ্ছে মশা মাছি, ওই খাবার আমরা খাইছি, খাওয়ার পরে রোগ জীবাণু সৃষ্টি হয়েছে।
দরিদ্র মানুষের সংখ্যা বেশি, তাদের খুব অভাব অনাটন, কিছু দিতে পারে না, ল্যাট্রিন করতে পারে না, নোংরা এলাকা, দুর্গন্ধ থাকে যা। আমরা যার কারণে বিভিন্ন ধরনের রোগ জীবাণু জড়িয়ে থাকি, যার কারণে আমরা হাত সাবান দিয়ে পরিষ্কার পরিচ্ছন্নতা করা হয় না, সংসারে অনেক ক্ষয়ক্ষতি হয়।
Gender inequalities play an important role in water, sanitation and hygiene coverage in rural communities. Adult and adolescent women bear the burden of poor access to water and sanitation and face the daily hardship of collecting, transporting, storing and managing water, as well as caring for family members suffering from wash-related infectious diseases, but have little or no influence in the decision-making processes related to access. Where there is no access or private latrines, women face the indignity of open spaces used as latrines and only during night time. Girls are more likely than boys to stay out of school, either because they are spending many hours in the day collecting and transporting water, or because schools do not have appropriate sanitation facilities, especially during menstrual problems that ensure their dignity, privacy and safety. Using CLTS and a gender-sensitive community-based approach, Oxfam has designed Access to Clean Water and Sanitation Initiative project is a consultative participatory process that includes the community, local partners and organizations. The ACWSI project is being implemented where the wash needs are the greatest amongst 10,000 of Bangladesh's poorest, most vulnerable people living in 20 villages in 2 districts, one in the coastal area of Hatia, Noakhali, and one in the river basin area of Diwanganj, Jamalpur. The project is funded by Oxfam Australia and ACWSI, and the objectives are to increase access to sanitation and sustainable water supplies and improve hygiene, and, where appropriate, integrate community-led sanitation with home-based livelihoods. to reduce gender-related wash inequalities and empower women, to strengthen the capacity of 20 communities and local partners and stakeholders, to document and communicate the knowledge gained from the experience of implementing the project and augment the knowledge and practices of the national wash sector. The Women's Wash Platforms (WWP) helped capacitate adolescent girls and women by identifying gender needs and using project schemes, designing and implementing small wash projects. Women's leadership in wash projects has led to specific gender-focused projects, such as the construction of 125 bathing cubicles in 20 intervention villages, which is a new idea in the WASH project. 302 unhygienic latrines were upgraded to hygienic and 770 new latrines were constructed. Additionally, 190 TW aprons were also given. The WWP groups also counseled with adolescent girls about hygienic management during menstruation and distributed menstruation kits to 250 adolescent girls. They also counseled against some social problems such as early marriage. The ACWSI project, along with the WWPs, sensitized and motivated community people to construct their own latrines and also provided latrines and water points to the poorest people in the community to ensure access to water and sanitation. They also worked to raise school sanitation standards through school hygienic promotion sessions. During the period of the ACWSI project, many water and sanitation projects were implemented. More than 14,000 additional people have easy access to safe water through 68 raised deep tube wells, 100 raised shallow tube wells, 4 rain-fed ponds, 1,000 chulli filters and 1,000 improved fire stoves. Water quality was monitored regularly by trained water quality engineers. More than 14,565 additional people have access to latrines. 2,913 household latrines were raised above the normal flood levels in Noakhali and Jamalpur. 20 gender-friendly school latrines with hand-washing facilities were constructed in all 20 intervention villages, where the availability of water was ensured through double-action pumps and rainwater harvesting systems with overhead tanks and running tap water without using electricity inside the latrine and basin for hand washing. These latrines are combined latrines for boys and girls, where girls are ensured of their privacy and dignity for menstrual hygiene management facilities and space. Targeting the whole community as well as students of local schools, community health volunteers, CHVs, community mobilizers, CMs, and child group members conduct courtyard sessions and school sanitation campaigns. Different international days like Global Hand Washing Day, World Water Day were arranged at community level for mass awareness development among the targeted people. 20 children's groups in 20 communities conducted community-wide 380 hygiene campaigns. They were provided with different IEC materials and incentives to be habituated to hygienic practices as demonstration in their own homes, neighborhoods, and amongst friends.
গভর্নমেন্টের বিগত নির্বাচনী ইশতেহারে যেটা ছিল 2013 সালের মধ্যে সকলের জন্য স্যানিটেশন এবং 2011 সালের মধ্যে সকলের জন্য বিশুদ্ধ পানির নিশ্চয়তা প্রদান করা, তারই লক্ষ্যে ACWSI এই প্রজেক্টের আওতায় আমাদের হাতিয়া একটা কোস্টাল, অনেক বড় একটা কোস্টাল এরিয়া, সেই এরিয়ায় আমাদের ওয়াটার স্যানিটেশনের ক্রাইসিস। পুরুষ মহিলা একসাথে পুকুরে গোসল করে, তাদের প্রাইভেসির কোনো বিষয় ছিল না। পানির সোর্স একদম খুব সীমিত থাকার কারণে আমাদের এই পানির ক্রাইসিসটা আমাদের খুব ফেস করতে হচ্ছে। আমাদের এই ACWSI প্রজেক্টের মাধ্যমে অক্সফাম ওনারা এরকম একটা পয়েন্টকে সিলেকশন করছে এই প্রজেক্ট এরিয়াকে, এই চরাঞ্চলের মানুষের জন্য ওয়াটার এবং স্যানিটেশনে যথেষ্ট কাজ করতেছে। আমরা এই উদ্যোগকে সাধুবাদ জানাই।
Various IEC materials were produced to effectively disseminate water, sanitation, and hygiene messages. These included puppets, leaflets, posters, flip charts, school wall paintings, and billboards. 1,000 households have received seeds and saplings under the project. Under the ACWSI project, different trainings and orientation was facilitated to build capacity of community people, women's wash platform, project staffs, local service providers, caretakers of water options, children group and CHVs, with the aim that these transferred knowledge will be sustained among the community even after the phasing out of the project.
পানি ছিল না, যার কারণে পানি পুকুর শুকিয়ে গেলে আমাদের খুব কষ্ট হতো। যখন পানি থাকে না তখন আমরা নারীরা গোসল করতে পারি না এবং ভালো করে পরিষ্কার হতে পারি না, যার কারণে পুরুষের জন্য সমস্যা হতো আমাদের। ওয়াক্সফাম থেকে এই গোসলখানা দেওয়াতে আমাদের নারী ও কিশোরীদের গোসল করার জন্য সুবিধা হয়েছে এবং আমরা ভালো করে গোসল করতে পারি।
Regular monitoring at grassroots level was conducted throughout the project to ensure quality and timely implementation of the project activities.
So the ACWSI project is a gender-focused WASH project which links in well to Oxfam's global profile on water and sanitation and hygiene. And particularly for us here in Bangladesh, it's really key that the approaches are replicable by the communities, by women in those communities themselves. Just some of the things that struck me on my last field visit was that there were various models being demonstrated that could be replicated. We had very high quality outputs. And the idea is that we get levels of learning that can be scaled up and replicated by other sector actors, by government and by the communities themselves.
The ACWSI project has brought changes in the lives of many people, particularly women and children in the selected villages, and resulted in their empowerment that ensured their improved access to sanitation and water.